retina behind, and in front it just converts into the epithelium covering the back of the ciliary body and the epithelium covering the back of the iris. Let us look at the things one by one. Sclera. It is a fibrous cord. In some text it is written that it is the continuation of the dura mater covering from the optic nerve. It is the one that is giving strength to the eyeball. It is white in color that you can see, and it is thin in front and thick behind, but it is weakest at this point, the point where the optic nerve enters the eyeball. It passes by making a lot of small holes in the sclera that is known as lamina cribrosa. Sclera moves, if you look at front, it has superficially covered with tenons fascia and tenons capsule, and between them there is a very small slit of episcleral space that have a some amount of loose connective tissue and blood vessels, and they do get engorged when there is an inflammation. Otherwise they are not very visible and the eye is seen as white. On the sclera, there is the insertion of all the six extraocular muscles. They are inserted into the substance of the sclera, and here the fascia surrounding the muscle becomes continuous with the fascia surrounding the eyeball. Anterior aspect, the part of the sclera that is actually visible, the white that you see in your eyes, that is covered with the conjunctiva, a layer of epithelium, columnar epithelium that is covering the eye, that is conjunctiva, that is known as bulbar part of conjunctiva shown here, and this is a transparent epithelium membrane through which eyeball is seen, and between it and the eyeball there is the presence of some amount of loose connective tissue, and this is the one that does contain some capillaries, and this leads to the redness of eye if there is an inflammation, infection of anything else. Then there is cornea. We are not going to discuss the histology section. This is covered by stratified squamous epithelium. Then there is basement membrane of that. Then there is stroma. And in the inner aspect, there is simple squamous epithelium covering hair with basement membrane known as deciment membrane endothelium. This part, this cornea, it is transparent. Why it is transparent? Because the collagen fibers here have a very regular arrangement, very parallel arrangement, and there are no blood vessels inside the cornea. There are no blood vessels inside the cornea, and that is why the cornea, in order to survive, get its nutrients from the fluid that is present behind it in the aqueous humor. They simply diffuse through the cornea to reach it, and the oxygenation, it occurs through the surface. It simply occurs through the surface. That is why for the people wearing the contact lenses, it is very important that you get high quality contact lenses that allow the movement of air through themselves, that will lead to the oxygenation of the surface of cornea. And if not, the lenses, regardless of that, lenses should be regularly taken off and on so that you can aerate the surface of the cornea. Otherwise they will ulcerate because of the lack of oxygen, and that particular fact is very important in this view also, that it will lead to the better survival of the corneal transplants, because it does not have any blood, that will lead to the absence of the transported white blood cells and tissue rejection. And between the two junctions of the sclera and cornea, this junction is sclerocorneal junction. This junction, the ring outside the cornea between the sclera, this is known as limbus, sclerocorneal limbus. And here you can see the curvature changes, here the transparency changes, and the interesting thing inside is that there is a vein running inside the scleral venous sinus, the canal of Schlemm, that is running in the circle in the junction of the sclera and cornea. And in the inner aspect, I will be better shown in this zoomed area. And on the inner aspect, there is a spur of sclera, this word, a spur of sclera protruding towards the inside the chamber, that is known as scleral spur. And actually it is between the scleral spur and the sclerocorneal junction that this trabecular meshwork is present at the iridocorneal junction, through which the aqueous humor go and drain the drain into the canal of Schlemm. This canal of Schlemm is ultimately connected to the multiple veins that are present on the outside, the verticose veins, and that is how the aqueous humor is drained. Then talking about the vascular humor, the vascular chamber, sorry, the vascular layer, the vascular pigmented coat. The vascular coat is surrounding all of the eyeball. It is, as the name indicates, it is vascular. It contains a lot of blood vessels that are coming from the anterior and posterior ciliary arteries. It supplies the retina inside and the sclera outside. And in the inner aspect, this whole layer is very heavily pigmented on the outer aspect. Sorry, on the outer aspect, it is very heavily pigmented. On the inner aspect, it is vascular. And the role of the pigmented layer is to make an eyeball work as a black box. The nerves that are entering the eyeball, the light rays that are entering the eyeball, they don't go on jumping and reflecting and creating a halo of light inside. When they touch any part of the retina, they get absorbed, they send a signal, and they simply get absorbed in the pigmented layer. So it makes the eyeball work as a chamber, as a black box. If we move forward, we will see these things. These are ciliary body and the iris. The ciliary body, it consists of a different set of muscles. First, there is a set of muscles that are running in a circle all the way across the ciliary body around the eye. So these are circular fibers, and the fibers that are running from the calcaneal skull all the way back to the surface, these are the meridional fibers. Then there are some radial fibers also, not discussing them right now. The ciliary body has these muscles. On the medial aspect, ciliary body has these projections. These are known as ciliary processes. If you are able to appreciate in this video, the ciliary processes, these are lined by this yellow line. This yellow line is the epithelium, ciliary epithelium, that is covering the surface of the ciliary body. This epithelium is responsible for producing the aqueous humor, the fluid that will fill the anterior and posterior chamber. Second, the ciliary body, the ciliary processes, it's giving attachments to these fibers. These are known as suspensory ligaments of lens or the zonular fibers. They supply the lens, they get attached to the lens, and they help pulling the lens to flatten it or get relaxed to get it more contour. So here the function of the ciliary muscles come into play. When the ciliary muscles contract, the circular ones, the whole of the rings come near. And when the meridional contracts, the distance between these 2 points, it becomes less. It comes here. So what happens in either of them is these ciliary processes, they move to this point. Ciliary process is moved more medially. When it moves more medially, the zonular fibers, the tension is released, and the zonular fibers, they are coming more medially, the tension is released, and the lens that was previously relatively flattened, it now gets more globular. It gives rise to high refractive power. So focus it helps you focus on near objects. So this is ciliary muscles function. So ciliary muscles, they have a parasympathetic supply that leads to their contraction, that leads to the loosening of the zonal fibers, that leads to making the lens more globular and ultimately helping you focus on the near objects. Second, the ciliary body was important in the production of the aqueous humor that will fill the anterior and posterior chambers of the eye, the aqueous chamber of the eye. So this is about the ciliary muscles. There is no very difference between the functioning of the two fibers, the meridional and the radial fibers and the circular fibers. They're ultimately all doing the same role. Then we come to this, the iris. It is filled with connective tissue anteriorly and it has epithelium posteriorly. You might be able to get a hint of a yellow line that is moving on the back of it. This yellow line, this epithelium that was covering the ciliary processes and that was covering the back aspect of the iris, this is the retina extension. That is the continuation of the nervous layer of the eyeball. It has no sensory function here. They're simply epithelium covering, giving the rise to the aqueous humor here, and they also have pigmented layer. And the pigment present in this epithelium layer is the major contributing factor for your eye color, the color of your iris. But yes, the pigmented layers, the pigments are also present in the connective tissue right here. In the connective tissue anteriorly, there is a pigment. If there is a pigment, the pigment, the more the iris will move towards brown black color. And that is why high the dark skin colored people usually have brown black eyes. And if there is almost total absence of the eye color pigment, it will lead to the blue eyes. So that is why the more white people, the more Caucasians usually have a variety of eye color, because actually it is due to the absence of the pigment, the melanin pigment, that the rest of the connective tissue give rise to that refractive colors. Then we are coming to the muscles in the iris. The muscles in the iris are the ones that are making the circle, that are the sphincter pupillary muscles. They contract and they make pupils smaller. These are supplied by parasympathetic fibers. And then there are ones that are going like a wheel, spokes of the wheel from the center outwards. These are radially running. These are known as dilatory pupillary muscles. And you may have guessed it, they have sympathetic supply. They have sympathetic supply. So there is dilatory pupillary muscles and there is constrictor pupillary muscles. So this is all about the middle layer, the vascular pigmented coat of the eye. We talked about the choroid, its outer pigmented and inner vascular layer, the ciliary body, the ciliary process, suspensory ligaments, ciliary muscles, and their supply. And then we talked about the iris. The iris was dividing the eye in the aqueous chamber into the anterior part and the posterior part, and the muscles contained inside it, that was the that was sphincter muscles supplied by the peripheral parasympathetic and the dilator by sympathetic nervous system. The nervous cord, it is the retina. Most of it retina. It is very thick. It consists of 10 layers. We will discuss it shortly. And it catches the light and sends the signals to the brain. If we move all the way front, here you can see the thickness dropping drastically. This point. At this point, beyond this point, it is visual. It is getting the signals. Here it is simply covering epithelium. The epithelium you saw on the undersurface of the ciliary body and the iris. So this line where this change occurs, this line is known as ora serrata. If we look at the chamber, it looks like a wavy line. So this is called ora serrata. You may see in the various models that are present in your uh, museums in the back of the retina. You can see the back of the retina through the fundoscopy. Fundoscopy is looking through the opening of the eye to the back of the retina. Here, in the back of the retina, you may see a few things. You will see the point where the optic nerve enters along with the central artery of retina. This is known as optic disc. This is known as optic disc. It is where the optic nerve enter along with the central artery of the retina, and it does not have any rods and cones. It is a blind spot. You don't see anything here. And actually your eye is moving very rapidly, little like this saccadic movements, that it compensates for the blind spot, and it rapidly falls the image on the areas surrounding so that you don't get the blind area. However, if you do paralyze the muscles, extraocular muscles, and the eye cannot move, you do see the blind spot. It is just medial to the anteroposterior axis of the eye. It is medial to the anteroposterior axis of the eye. Okay. Then there is macula lutea and fovea centralis. Just to the lateral aspect of the anteroposterior axis, or just to the lateral of the optic disc, you can see this whole yellow area. The whole of it is yellow, but you can see this part is relatively more prominent. This yellow area is known as yellow disc, yellow spot, macula lutea, and in the center of it there is a dip. This dip is known as fovea centralis. Fovea centralis. Fovea centralis is the point of the most acute vision in your eye. It only consists of cones here, no rods are present here, and if you are looking at my pointer here, the image of the pointer is currently being made on your fovea centralis. It is the point with the highest concentration of the retina, highest concentration of the cones. Then we are left with the lens. The lens consists of layers of connective tissue fibers, mostly elastic. It has a capsule on its surrounding. On the anterior aspect, there is a simple layer of cuboidal epithelium, and this is the layer that, as it duplicates, it goes to the periphery, and the cells elongate and flatten, and they become the part of these zonular fibers, and this the part of the fibers that are flattened fibers that enclose whole of the lens. And the central part is the nucleus, and the periphery is those fibers, and they continue to get deposited throughout the life, and that's why you get problems with the focus in the older age. Let me So the lens has a capsule, the the capsular epithelium in front that is usually cuboidal, and the different fibers, the elongated fibers that are making the major part of the lens. That is not much to discuss here. There is the layers of cornea, the stratified squamous epithelium in front, followed by basement membrane, that is Bowman's layer. Then there is stroma, used with very regularly arranged stromal fibers. Then there is simple squamous epithelium, endothelium on the inner aspect with its basement membrane known as Descemet's membrane. And this structure of the cornea, it's very sensitive to the touch. And if you asked about the blinking reflex, the blinking reflex occurs when the cotton wisp touches the surface, and the sensory fibers are carried through the nasociliary nerve to the ophthalmic division of the trigeminal nerve, and within the pons they get synapsed with the facial nerve nucleus, and the efferent fibers come and they contract the orbicularis oculi muscles, and they contract the eye eyelids, I mean. So these are the things about the contents of the eyeball. We have discussed about the light. You must have may have read up, um, discuss the light pathway in the physiology lecture, the special senses that are coming up the crash course. You can follow this video playlist and can go through that. This light pathways goes through the cornea, aqueous chamber, lens, vitreous chamber, and then falls on the retina. The whole detail is discussed in the physiology lecture. The thing I want to discuss is that there is the maximum bending of light occurs at the interface of air and cornea, because there is a highest difference of refractive chamber. And then there is a confusion that most refraction occurs at the cornea. Then why the lens is so important? Because for whole of these structures, the lens is the one thing that actually can change its diopter, that can change its focal length, and it helps to focus it on the retina. We talked about the chambers. The chamber that is present anterior to the lens, that is the aqueous chamber. It is further divided into posterior and anterior chambers. That aqueous, it is filled with aqueous humor, the fluid. The aqueous humor was being produced by around the ciliary processes and drained into the posterior chamber, then moves through the pupil into the anterior chamber, and in the anterior chamber it moves to the angle between cornea and iris, the iridocorneal junction, and from here it moves through the trabeculae to go into the veins that are canal of Schlemm. And here, any blockage in this pathway may lead to glaucoma, that is the high pressure of the aqueous chamber. The closed angle glaucoma is the one where sometimes this iris, it gets attached here before going back. So it is blocking the pathway of the aqueous humor draining. So this is known as closed angle, the narrow angle glaucoma, and that is solved by making a pathway, that is solved by making an opening that leads to the drainage of the glaucoma. And then there is open angle glaucoma, that it may be blockage in the trabecular network, or there may be blockage in the canal of Schlemm, or surplus production in the ciliary bodies. So it is usually controlled medically, and there are some surgical procedures there too, but we will stop right here, not going into the detail in anatomy. And then there is this chamber, the behind the lens in front of the retina, that is known as the haloid vitreous chamber, and it is a jelly-like substance that gives support to the whole of the eyeball, and it keeps the retina pushed back to the choroid. The retina and choroid are not very much, well, technically not retina and choroid. The retina itself has two layers. The retina itself has sensory layer and the pigmented layer. You can see this layer is the pigmented layer. This whole is the neural layer. So the neural layer and the retinal and the pigmented layer are not physically attached to one another. They are pushed back by this vitreous chamber. And if there is some trauma, these two layers may get separated from one another, and that is called the detachment of retina, and that leads to the blindness until the retina it's pushed back to its normal place. Talking about the layers of the retina, talking about the layers of the retina, if we look from the deep to the surface, the layers are usually numbered. Then there is a, if we look from the deep to the surface, it is covered with, there is pigmented layer of epithelium, then there is layer of rods and cones, the sensory receptor component of the cells, there is outer limiting membrane, then there is the nuclear layer of the rods and cones, that is outer nuclear layer, Then there is a plexus of the nerves where the rods and cones synapse with the next set of nerves, that is the outer plexiform layer. Then there is layer of bipolar cells. Then there is next layer of synapse between the bipolar axons and the next neurons, that is inner plexiform layer. And the next neurons are ganglion cell layer. And then there is nerve fiber layer, that is the axons of these ganglion cells, and this is actually the optic nerve that will exit. And just near the vitreous body, it all is limited by the inner limiting membrane. So these are the 10 layers of retina. We will discuss it in the histology lectures, inshallah. And in addition to it, there are other cells like amacrine cells, the horizontal cells, and the supporting cells that are running vertically, that are the Muller cells. The light that comes, actually it comes from this way all the way through this layer, and they activate the receptors right here. And the signal that is then generated, it moves back through the rods and cones, through the bipolar, through the ganglion, all the way to the optic pathway. I will not be discussing the optic pathway in this lecture. You have discussed that in the physiology lecture. I will have a quick summary, a quick revision when we will be talking about the cranial nerves, inshallah. So this is all about the layers of the retina. And then let's talk a little about the rods and cones. This is the pathway. Rods and cones, then bipolar, then ganglion, then optic nerve. Roads, this is the picture from the Kaplan's neuroanatomy. The roads are the ones that detect the low light, that are active in the low light situations. They do not have any color, they simply go black and white, achromatic, light sensitive, and they are very sensitive to motion. They're very sensitive to motion. And the animals that hunt at night that have very high quantity of rods, like feline animals like cat and lion and tiger. And the cones are of different colors. There are red, blue, green, the primary colors, and they are chromatic thus, and they are sensitive to bright light, and they make and join to form different colors, and they are responsible for object recognition. Visual pathway I'm going to skip right now. You have discussed in the physiology lecture. You made and you will discuss it again with me in the cranial nerve section. So I am skipping the visual pathways and the reflexes. So just going to the last topic, that is periorbital structure, that is majorly the eyelid and lacrimal apparatus. The eyelid is the musculocutaneous, fibromusculocutaneous structure that is covering the anterior aspect of the eyeball, giving its protection.